Welcome, everyone, to the podcast dedicated to empowering women by exploring effective strategies for managing polycystic ovary syndrome. I'm Alfin, founder of Sister, and joining me today is our in-house functional medicine expert, Dr. Ekta. Welcome, Dr.
Hi, Alfam. Thank you for having me here.
So let's begin by looking at the most common treatments for PCOS. Doctor, could you outline what treatments are typically recommended for women diagnosed with PCOS?
Yeah, usually, if you look at from the conventional point of view, it's basically the symptom-based treatment. So it is birth control pills to regulate the irregularities of periods, and they also prescribe metformin if there is high insulin level. But then there is spironolactone, so it's more pharmaceutical, which is targeted mainly for addressing the symptoms rather than deeper diving and looking into more of the root cause. Yeah, that's pretty much.
Yes, thank you for sharing that. So, Dr. Ekta, what are some of the benefits as well as potential drawbacks of some of these conventional treatments that you commonly see in PCOS treatment?
Well, yes, it can regularize your periods in most of the patients. They do help them. But at the same time, they do have the side effects as well, like body weight is not still in control. And with every pharmaceutical, there are some side effects attached. So there are the reasons that the patient compliance goes down. And sometimes like the patient is in a, they are in a loop, in a cycle that they just want to come out, but they don't have a decent enough exit to come out. So those are the kind of things.
Given these limitations, it's important to look at approaches that support long-term well-being and empower women to understand their bodies better.
Yeah.
One such approach is integrative medicine. Dr. Ekta, could you explain what an integrative approach to PCOS involves and why someone might consider it?
Yeah, well, personally, I think that everybody should be offered individualized plan because we all have a very unique set of genetics and a unique set of environmental surroundings where we are. So the causative factors are very different for each and other individual. It is not the same. So it's not like one size fits everyone. That's the reason. And that's the beauty of having the personalized treatment plan rather than just slapping on birth control pills or any other anti-androgens. It's better to do a deeper dive, look into the root cause, what is the causative factor, and then address the causative factor. And the symptoms, they will definitely go away once you have addressed the root cause. So that's the thing, and that's the beauty of integrative medicine. And in that case, what happens is that you take a detailed patient history or the client history. So you go through, like all the details about their lifestyle, where they are living, any past conditions, any family history, everything in detail about the toxins, about the environmental pollutions that they're going through, because there are so many endocrine disruptors that we're not aware of, and they do have a bigger impact on our body. Yeah, taking into consideration of all of those factors and the diet, that plays a very, very big role here. And many other stressors, your sleep pattern, your activity, your lifestyle, basically considering all the background, and then you can come up with a plan, and then you can treat them accordingly. And of course, if they need any sort of medical treatment, it's nothing that you can't have it. Yes, of course you can have it if it's required. If you see that, yes, this particular thing can only be helped with any particular kind of medication, yes, of course, you should take that. So I'm not saying no to that. But you can't undermine other lifestyle factors that needs to be taken into consideration. And many of the symptoms, you'll be surprised to see that many of the symptoms, they will just go away with slight tweak in a lifestyle.
Yeah, that makes so much sense, especially when you consider how complex and varied PCOS can be, woman to woman.
Yeah.
And are there specific benefits that you've seen across using integrative model for treating chronic illnesses?
Yeah, if we take PCOS, the symptoms, they are so varied. Not every woman will experience the same symptom. And it's like sometimes you will see that not all of them are obese, but they still have PCOS. They do have insulin resistance. So the insulin resistance, it kicks in first and then the obesity starts later. Many of the times you see that. They're not even aware of it because sometimes it's, they think that so if someone is obese, if there is an obesity, then that leads to PCOS. Well, it's a kind of a loop. Obesity definitely worsens PCOS, but sometimes you will be surprised to see that there are, like really lean, thin women, but they still develop PCOS. And then you will wonder that why this is happening. And then if you do a deeper dive, then you will find out that there could be some stressors because of which the person has developed insulin resistance. And if you take that stressor out, then in that case, the insulin resistance can revert it back or it can, come to the baseline. So before things goes all the way, it sets up a downward spiral, you can just remove the triggers, remove the stressors, and the things can come back to normal. So these are the things basically that you can address.
I suppose in the approach then, you do some investigation initially, right? That's the first thing.
Yeah, I would say that a full detailed medical history is required, along with the past history, and family history is also very important here. And that will give you some idea what needs to be checked and what not. Sometimes the picture is really clear, then in that case, probably you don't need it. But if you feel like with the with the history that patient is giving or the client is giving to you, in that case, if you feel like that, no, I need to understand a bit more about the person, what's going on in the body, the picture is not very clear, then in that case, yes, of course, we do need to go for certain tests. And there are so many now at the moment that can help us.
Yes. So that naturally flows into functional medicine, which is a big part of what we do at Sister. For our listeners who might not be familiar, how would you describe functional medicine and how we use it at Sister?
Well, functional medicine, it is a very beautiful thing where we do not just address the symptoms, but we look into the root cause. What is causing the symptom? It's not just addressing the symptoms, looking at the symptoms and giving the medication and just abolishing it there and then, because it will come back again. You haven't addressed the root cause, then in due course of time, the things will come back again. But if you have looked deeper into the things, the causative factors, why it is happening and why the things have gone, why the things are not right, why the things have gone wrong. If you address that factor, then in that case, yes, you will get better results. So this is what is functional medicine, looking into the root cause, looking into the diet of the patient, looking into the lifestyle, they treat the patient as a whole, not just only a symptom. In conventional medicine, it is more like, there are different body parts and different body parts are affected and then you treat that particular thing. Whereas here it is like you treat the whole body, not just the body, but the mind and the soul as well. So it includes mindfulness and it includes breath work and everything. So basically, if your whole body is healthy, then definitely you will feel better.
Absolutely.
Yeah.
That's exactly what we aim to provide at Sister, a path to real lasting change.
Yeah.
Thank you, Dr. Ekta, for breaking down all of this and giving our listeners such a clear picture of what's possible beyond conventional care.
You're very welcome. Thank you for having me.